It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. But I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
Toby, welcome.
Thank you.
To your home. Thank you for having us. It's really an honor to be here. When we sat down 18 months ago, not even 18 months ago, the entrepreneurs love talking to you. And why they like talking to you is because most hospital CEOs aren't as entrepreneurially minded as you. And I think that what I think was supposed to be about a 45-minute chat ended up being about an hour and a half. And your kind invitation to come down here was met with open arms by us, and we're excited to be here today. Specifically, when you joined Cleveland Clinic 40 years ago, and you look today at what has happened over the last 40 years, how is healthcare different, and maybe how is it similar?
Wow. Well, first of all, thank you very much for the very kind introduction. You forgot to mention all my failures in that. And there were plenty of them, and entrepreneurs understand about failures. And it's an honor to have you all here. I don't think there's probably anything more fun, more frustrating, or more important than developing new approaches. So I am fully supportive. Healthcare has changed just incredibly over time, but I think you have to look at the diseases we're treating, how we treat them, where we treat them, and who treats them. All are changing. And in fact, we're not just thinking about treating disease anymore. We're trying to keep people out of the hospital. We're trying to essentially put ourselves out of business, but I don't think that's probably too likely. People always ask me, well, if you cure this, aren't you worried that about your income? People always get sick eventually. So we'd rather have them, but anyhow, what we see is the disease are changing. We're no longer dealing with as many acute diseases as we did. We're now dealing with chronic disease. The techniques that we use have changed enormously. If you look at the natural history of medicine, it goes essentially from surgery is generally the first one in, then take tuberculosis. Tuberculosis all used to be treated surgically, and then streptomycin came along, and then prevention came along, and that's sort of the natural history. And we're seeing that in cardiac disease and lots of others. So we're moving more and more to chronic diseases and more medical things that are not so many acute diseases. We're seeing where people are being taken care of. It used to be always in a hospital. And now we're moving more and more things to outpatient facilities and eventually to home. Then finally the people are looking after them. We now have, I think, 1,800 mid-level providers working at the Cleveland Clinic. So the whole landscape has changed and will continue to evolve that way.
And what's similar? What's the same as it was 40 years ago?
I think the motivation for people going into medicine hasn't changed. People are going into medicine because they want to help people. But what is added onto that is not just helping people, but making care affordable for people and high quality. And our transparency around those two things is becoming more and more expanded.
So when you think about the biggest challenges that hospital systems and payers, maybe pharmaceutical companies, and even entrepreneurs trying to change healthcare have today, what do you think they are?
Well, one of the things that's happened, I think, across the world, really, is that as people age and we get more and more technology, we're finding out that the cost of healthcare is skyrocketing. And it's getting to the point where in the United States it's starting to force out things like education, other social programs that we want to do. In fact, if you look at every state, the biggest part of their budget is Medicaid. And so they're worried, and we as a country are worried that we are going to spend so much money on health care that we can't afford all the other things. So we understand that we have got to control the exploding cost of health care, and I think that's heading, first of all, it's heading towards providers, and then it's going to involve everybody else in a ripple form. And, we're going to have less money for what we do, and then we're going to turn to the device manufacturers and the pharmaceuticals and the IT and say, geez, you've got to help us take the costs out as well. Just like cars. Mm-hmm. Our cars in the United States didn't used to be affordable or high quality. And now, the companies have gone and they've improved the quality, and they've gone back to all their providers, and they've all ratcheted down and made it a more efficient system. So that is one of the big challenges right now. But as we do that, we're also having a tremendous emphasis on quality. And it's all becoming transparent now, and the government's making it transparent, and companies are coming around and tell you about the quality of the leapfrogs, et cetera. We now report 115 quality metrics to the federal government. And then next thing is going to be price transparency. And that is going to affect everybody in healthcare.
What do you think regarding price transparency? Because you wrote about that in your book, The Cleveland Clinic Way, which came out last January, which is a great book. But you talk about these 8 trends.
Say more about it. Come on.
And if you haven't bought your copy of The Cleveland Clinic Way, but it's a great book, and it talks about the 8 trends, and transparency, obviously, and personalization are a couple of them. But let's talk about transparency for a few minutes, because I think there's a lot of talk about it. There's concern about it. How does that affect people today, and how do you think that affects people over the coming years?
Well, we're big believers in transparency, and what let me go back and tell you where I learned about transparency and the importance of it. Transparency is not just of transparency about the hospital to the outside world. It's about inside the hospital. Mm-hmm. It's about what we do ourselves. And we learned about this way back in the early 1980s when we were looking up a bunch of patients who had cardiac surgery or redo, and they said they're doing great when we called them, but they said, by the way, we had hepatitis. And we said, gee, when were they got the hepatitis? We looked, and they're getting 13 units of blood. So we said, we got to reduce the units of blood that we give these patients, because and we didn't even know that the blood that we were giving was hepatitis positive at that point. And what we did was we made apparent to all the surgeons on a monthly basis how much blood their patients were getting. And the blood utilization dropped like a rock. Now, stop and think about it. All of us who went to medical school were used to seeing our names up there with their grades. I didn't start looking up here. I started looking down here. It was all, your grades were there, and it drives behaviors. Probably nobody more competitive than doctors. And so we started out with transparency around within the hospital, and it drove our improvement.
How long ago did you start that?
We started that back in the cardiac surgery in the early 80s. And then what happened was we said, well, look, I think when we probably now took 25 years ago, we said, the cardiologists and the cardiac surgeons work together, and the cardiologists ought to know what the mortality rate and our results were for what we do in surgeons, because they're going to advise their patients. So we started having a once-a-year report. And then the report, they said, well, can we have your slides? And so we give them our slides. And then we said, well, why don't we put it in a booklet for them? So we put it in a booklet for them. And then we said, why we give it just to our cardiologists? Let's give it to everybody. So we sent out, I guess, 50,000 of these booklets showing the good, the bad, and the ugly of what we did. There are 2 important things about it. First of all, it made us look at our results and put metrics on it. And every time we did that, we found out that there was something we're not doing as well as we should. And we direct our attention to it, and it'd get better. And the second thing is, we are a community asset, a societal asset. And our responsibility is to society, and we ought to be reporting it. So 10 years ago, we took that thing that we'd done in cardiac surgery, and we applied it across all of our institutes.
Was that right around when you became CEO?
I did. I didn't make myself very popular then.
Well, that's
for a lot of other reasons.
Because the resistance, and one of the most admirable things about what you've done here at the clinic is, despite all the obstacles, and entrepreneurs know, as you mentioned, a lot about obstacles getting in your way.
Yes, they do.
It seems like you went through and walked through walls to actually make a lot of this happen. What was some of the resistance to change? Because I think that's, from a lesson standpoint, often daunting. I think this industry can intimidate a lot of people to not even try, but it didn't scare you, or
well, it didn't scare me particularly, because at that point I wasn't running for office. which was a good thing. And plus, the organization, the Cleveland Clinic, is an organization where we are essentially a group practice, and we are motivated by the patients. And so we always went back to when we said our mantra is patients first, and if we always went back to the thing is, what is the right thing to do for patients? And when you come to a fork in the road, that always directs you that's our North Star, and always takes you in the right direction. So that was a great impetus for us to do the right thing. And it became pretty clear that collecting the data and setting up the metrics and being transparent about them was the right thing to do.
So were people not on board and culturally, because I think culturally, we always say for entrepreneurs, find the organizations that are startup friendly, that are leaning in and excited to work with you, not ones that are resistant to change. Clearly from the top down, this is a organization completely focused on innovation. It probably wasn't always that way.
No, but it was pretty much always
did some people have to lead to kind of adapt to some of this, or was it really just from the beginning always everyone's entrepreneurially minded?
Yeah, because let me just suggest to you entrepreneurs that probably one of the most important things you do is connect yourself with the right kind of an organization, because not all organizations are willing to look at something new. And this organization happily was formed by a group of physicians who were entrepreneurial. I mean, if you look at our organization, we're unlike most organizations in the country. And George Kreil was an individual who started the first blood transfusions, and he went on from there to investigate how you looked after thyroids, and then he was fascinated by the heart rate of whales. I mean, this was a fellow who was really involved in trying to do things differently, and that has just permeated the institution from the very beginning. And, we've tolerated a lot of entrepreneurs along the way, crazy people. And, probably one of the best was a fellow by the name of Mason Sones. Mason Sones, who did the first coronary angiography, and I got called to his office one day, and he said, "What the hell are you doing? My patient's up there on the floor, and he's anemic, and you won't give him any blood." And I said to Mason, you didn't know what you're doing when you did the first coronary angiograms. I really don't know what I'm doing here, but give me a chance. And he said, go for it.
That's fantastic. So,
and that was a sort of the spirit of the place. We got to do it differently, because what we're doing now ain't going to get us to where we want to go.
So I know it sounds like you're making out like you're carrying the torch, but the reality is you made a tremendous amount of headway, probably more headway than any other organization around the planet in this regard. When you think about the notion of thinking big, as a leader, thinking big, and surrounding yourself with a great team, we always talk about entrepreneurs needing to, that's the number one thing, your vision and most importantly your team. Who do you surround yourself with? Love to hear a little bit about your philosophy about that. Not only the need to think big and think beyond what is traditionally being done right now, but also the quality of your team.
Well, I don't think there's any question. The most important thing the CEO does is select people to go around them, and generally I get it right about half the time. I think that's a pretty good batting average. That's about average. But I think one of the things, and I frankly learned this from Jack Welch, is by the time you decide it's time for somebody to change, everybody else is wondering why you haven't done it. And they say, well, obviously that person wasn't the right fit. And so people are not the right fit for lots of reasons. But the ones that I find with doctors, frankly, is not that they're not smart enough and they haven't been trained well enough. It is a societal fit that they don't make it into the culture. And we've had people who didn't make it for just that reason.
And when you mention half the people that make it, do you look for that? You continually curate your team and obviously make sure the very, very best are there. And
yeah, we try to get better all the time, and it's a process of continuing to grow the organization, and just like look at all the startups in Silicon Valley. generally the entrepreneur is not the person that takes the company on to grow it to a billion-dollar organization. It's a different different skills, different times, different capabilities.
So clearly you guys have shared your intellectual capital with a lot of people. You've written books. Your book, there was another book written out that's being handed out here about the Cleveland Clinic Way. Other organizations I know are in this audience, payers, other providers, pharmaceutical companies, even venture firms who've not been involved in digital health and healthcare, even recently coming in. What's some of your advice to others to emulate and even create their own path of innovation, but make sure they embrace it, and specifically to get to their CEOs to think more like you?
Well, first of all, I think you have to look at, when you're thinking about starting something, you have to look at a need. I used to come home from the operating room and bitch about something that wasn't right, and my wife Anita told me, well, why don't you do something about it? Pick out something that's a problem. Oh, so I tilted with a lot of windmills. I think you have to figure out something that is a problem and work on that. But you're never going to get the right answer if you go to a group of people and ask them, is this the right thing to do? I'd tell you two cute stories that in retrospect probably make me shake my head. One of was I thought that maybe we could close holes in hearts by a catheter. And so we developed 2 umbrellas that would fold up and go in a tube, and we'd push them in a catheter and through the hole and blow up one umbrella and then blow up the other umbrella on the other side of the hole. And we had a locking device and a centering device. And I remember I went to one of the companies after I had spent quite a lot of time and effort working on this, and they said, we're never going to do anything to the heart with a catheter. That product has now been developed, and that's where you close all the holes in hearts and PTCA and stents.
I got to give a round of applause.
There were 2 or 3 more just like that. So you can't go and expect the current status quo to accept something that is totally out of the park.
We need the second cute story.
Second cute story was I thought that maybe the best replacement for a heart valve was a normal valve from a human being. So we spent a lot of time from the coroner's office here harvesting heart valves. We'd put them in a soup of antibiotics, and we'd Federal Express them out to California. They'd freeze them, and then we'd throw them out, and they were alive when we thawed them out. And so we worked for a couple of years on this technique, and we thought we could get rid of the bacteria, and we thought we had a solution for this, for the heart valve problem. And the same company told me that they didn't think that they were ever going to use human tissue and other humans. Well, that's now a whole company that's freezing human tissue and replacing it. So I think that the lesson is that you're not going to get there with the current thinking.
Perfect segue to my last question, which is we always talk about, as we'll be talking about in a few minutes, we're at the beginning of an epic decade where the next 10 years will look vastly different than even the last 10 or 20 or 30. Healthcare reform is a big instigator of change. The acceleration of chronic disease is instigating the need. But mobile devices, sensors, big data, analytics, which Jeff and Mel talked about last night, and then finally this golden age of entrepreneurship. There's never been a time in history where entrepreneurs, not only within this industry, but from outside this industry, coming in, a lot of physicians coming in to become more entrepreneurs and startup driven. What does the next decade look like to you? And when you look out 10 years, how has the world changed?
Well, first of all, I'm really jealous that you guys get the opportunity to do this. I wish that, this was a stage in my career where I was doing the same thing, so I'm incredibly jealous of your opportunity. I looked at, you stop and think about the development of the data that we see coming around healthcare, and I think I said yesterday that if you look at healthcare, it's made its transition from an art, to a science, and with science comes data, and with comes data, it has to have a way to take care of it. It's not an abacus anymore. And so now we've got this tremendous digital revolution that is allowing us to have all that data and new ways to gather data. So, there's really sort of two aspects to this. One is the companies that collect it, and then there's the companies that make sense out of it, or the groups that make sense out of it. We're in a happy situation right now at the clinic that we're working with Exploris, who's got a huge data set, and IBM, who with their Watson, which you'll be hearing more about tomorrow, who has the ability with artificial intelligence to begin to make sense out of some of this. So as the data comes in from all the sensors, and there's going to be more and more and more sensors, I saw some.
You'll see some today, yeah.
Yeah, I saw some fascinating ones already. That you can just imagine that we're taking this to another level, and then the genomics that comes with this, our understanding of the human condition is going to completely change how we begin to think about health and preserving health, and rather than just treating disease.
And you'll see some of those today too. Toby, thank you so much. As you know, we call the entrepreneurs in our program healthcare transformers. There's 165 of them in these 84 companies. Clearly, without a doubt, you have earned yourself, again, because I think I gave you one of these when you first spoke to us. Every entrepreneur in our program and the community wears a pin that says healthcare transformer. We can do a whole healthcare transformer activate thing. But Toby, I'd love to pin this on you and allow you to be
great.
once again brought to our community. And
thank you.
It's a healthcare transformer.